So in this video, I want to talk about pelvic organ prolapse, what it is, what are some of the grades, and what we can do about it. So I have my bladder here, the uterus and the vaginal canal, and the rectum. And these organs are meant to sit nicely, let's see if I can get this at a good angle here, nicely up in the pelvis. Now, there are a variety of different reasons that can cause pelvic organ prolapse, and essentially what that is when either the bladder, the uterus, or the rectum starts to descend down toward the opening. And so prolapse can happen with any of the organs, and essentially they begin to descend and move toward the vaginal opening. So there are 4 different grades of pelvic organ prolapse. So a grade 1 would be considered mild, where it's just a little bit of descent, but it hasn't reached the opening. A grade 2 is when, I'm just going to use my bladder as an example here. Grade 2 is when it starts to descend and it's just sitting at the opening. So it hasn't come outside, but it's sitting right near the opening. A grade 3 is when it starts to protrude past the opening. And a grade 4 is when it's really quite a significant protrusion through the opening. And this is quite common in postpartum to have at least a grade 1 or 2. And sometimes having a mild prolapse can be symptomatic, while a grade 3 may not be symptomatic. So it's going to be individual to each person. And so having an assessment done to see kind of where things are standing is a great idea to get a sense of, oh, is there a prolapse, but I don't sense and feel it? Because there's so much we can do from a prevention perspective. For example, addressing constipation and straining on the toilet. That can promote prolapse. Well, if we control our bowels and make sure things are really easy on the toilet for us, we can actually reduce stress and strain on the pelvic floor and again, prevent a prolapse from starting or getting worse. If you are having symptoms of heaviness, pressure, this feeling of something's coming down or something might fall out, those are common descriptors that clients will use, which when we assess, there's some evidence of pelvic organ prolapse, and pelvic floor physiotherapy can really help reduce symptoms, help you get through your day-to-day activities with less symptoms, and sometimes you may need additional interventions, but pelvic floor physiotherapy, regardless of whatever the intervention is going to support the other intervention's success. So the first step with any kind of symptoms of pelvic organ prolapse is to get an assessment done by a pelvic health physiotherapist, learn how to reduce the risk factors, learn how to support your pelvic floor and your core so you know how to do your day-to-day activities without putting more pressure on, and then working with your pelvic health physiotherapist and possibly other practitioners to support you feeling good and getting back to the activities you love. If you have questions, drop me comments, or if you want to book an appointment, use the booking link.